Welcome to EP Edge Heart Talk, a podcast created to guide patients and caregivers through heart and heart rhythm conditions, clearly, calmly, and with real medical insight. I am Dr. Sharma, cardiologist and cardiac electrophysiologist. Every day I meet people who say, I wish someone could explain this in a way I can actually understand. That is exactly why this podcast exists. EP Edge Heart Talk provides reliable, simple explanations about arrhythmias, pacemakers, ablation, and heart rhythm care. No jargon, no confusion, just clear guidance that helps you make confident decisions. Today's episode focuses on a topic nearly all of us interact with: smartwatches. If you've ever received an alert saying irregular rhythm or possible AFib, you know how alarming that moment can feel. So in today's episode, we're going to break this down clearly. We'll explore how accurate smartwatches truly are, when alerts matter, why false alarms happen, whether smartwatches can replace heart monitors, and how to use these devices safely. Let's begin. More than 500 million people now wear smartwatches. For many patients, the first clue of a heart rhythm problem comes from a smartwatch alert, not from symptoms. So understanding what these devices do well and where they struggle is essential. Patients often ask me, can I trust my watch when it says I might have atrial fibrillation? When smartwatches capture a clean ECG strip, the accuracy for detecting AFib is very high, around 95%. Even the green light sensors called photoplethysmography perform well. But in younger healthy users, false positives become more common. My take for patients: if your watch captures a clear ECG showing possible AFib, take it seriously, but always confirm with your doctor. Smartwatches do get confused. People with pacemakers or ICDs, left bundle branch block, very low voltage signals, frequent skipped beats, or shaky hands often get inconclusive results. That doesn't mean something is wrong with you. It means the algorithm is unsure. Think of it like trying to read handwriting while riding in a moving car. After an AFib ablation, many patients ask, is my smartwatch enough to check for recurrence? For many people, yes. When worn consistently, smartwatches detect meaningful AFib episodes almost as well as implantable monitors. They may miss extremely short episodes, ones that usually do not change management. But if you are high risk or your doctor is considering stopping your blood thinner, a more sensitive monitor may be required. Even though smartwatches are accurate, false alarms still happen, especially in younger users. It's a math issue. When only 1% of people have AFib, even a very accurate device can generate many alerts in people who do not have it. A false alarm does not mean your heart is in danger. It means your watch saw something unusual and wants a second look. Here is how to use your watch correctly. If you get a possible AFib alert, sit down, relax your arm, take a clean ECG, send the PDF to your doctor. After ablation, a few clean ECGs per week are enough. If you are young and low risk, understand that most alerts will be false positives. Turn off notifications if they cause anxiety. If you have a pacemaker or frequent skipped beats, expect inconclusive results. Watches are not the right diagnostic tool in those cases. To summarize, smartwatches can detect AFib accurately, help with post-ablation monitoring, and provide early warnings. Smartwatches cannot evaluate paced rhythms, left bundle branch block, extremely low burden AFib, and they cannot decide whether blood thinners are safe to stop. They are powerful tools, but they work best when paired with medical expertise. Thank you for listening to this first episode of EP Edge Heart Talk. If you found it helpful, follow the podcast and share it with someone who uses a smartwatch or has AFib. Thank you for joining me for this very first episode of EP Edge Heart Talk. I truly appreciate every listener who's beginning this journey with me, and I'm grateful for the trust you place in this podcast. I look forward to guiding you through many more conversations to come. I'm Dr. Sharma. I'll see you next time. Bye for now.